Well, Dr. Ghatan, a dermatologist works with the skin, and does a dermatologist like you know of what to do when you get bitten by fleas or bed bugs and how to get rid of them and that type of stuff? Because that seems to be, from what I hear, quite a job.
Yes, there is a big fascination with bed bugs nowadays, and people are very much afraid of it, and they come to us with different rashes, and they're afraid, and they ask me if this bed bugs. Bed bugs have obviously different presentations than some other rashes. It's not always easy to distinguish between bed bugs and scabies, say, or flea bites. The treatment, for example, for bed bug is really to eliminate the source.
Makes sense. But that doesn't seem to be so easy.
Well, you need to get an if you do establish a diagnosis of bed bug, then you advise the patient to get an exterminator. And there are people who specialize in this now. And they come, they check the house, and they throw out the beds usually if they suspect any bed bugs in there, the mattresses.
So your bed is gone. You need a new bed.
Right. This is the method that I'm being familiar up to very recently. I saw an ad a week or so ago from a company that has a new treatment. They don't throw anything out. They come in. They require about 4 hours. People should leave the house. They have some generators that bring in heat to the house. They say, I think, about 120 degrees Fahrenheit. And supposedly that kills the bed bug. They don't have to throw anything out. And it's something, it's interesting. I don't know if it really works or not, but there's one company I know of that does that. So for treatment of bed bug, the main thing is to remove the source. And then we treat the patient symptomatically, meaning that we try to help them to alleviate the itching sensation by giving them topical creams or otherwise treating them. In terms of the flea bites are often associated with cats and dogs. We ask the patient if they have any cats or dogs, or they have friends who have cats and dogs. They go sit on their furniture, they sit on the couch, and the cats sit on the couch, and they have fleas in there. They can catch the flea from that. So again, the treatment would be to get rid of flea bites. You got to have the cat or the dog be checked out by the vet and treated accordingly. And we treat the patient for the itch, and it goes away.
Which basically, treating the patient basically means probably do something which makes the itching not to be so severe, and then after a few days the whole thing goes away anyway, right?
Right, exactly. And the same thing applies to insect bites. The insect bites, a lot of times, you can just use a topical cream and help the itch, and it's going to go away. And it's interesting about insect bite. People can be exposed to some insects, and there are so many variety of them. Millions of different kinds of insect bite. A lot of them are tiny little creatures that they sit on you and they walk away and fly away, and 2 days, 3 days later you get a reaction to the saliva that was left on the skin, and you get a little redness, and it's very like a veal, and it's very itchy. At that time the treatment would be just to treat the itch. Sometimes they do get infected because there is a break in the skin. There could be a secondary bacterial infection. In that case, there may be a need to open up the pus, to get the pus out, or to give oral antibiotics, medication by mouth, to get rid of the infection that could have been caused by an insect bite. As long as we're talking about these bites, I want to mention about the scabies, which is a very common infestation. Scabies is, for the most part, a sexually transmitted disease, but it could be transmitted non-sexually. For example, you go to a hotel and you sleep in the sheets, in the beds and everything, and somebody else had been there and they had a scabies. The scabies may remain on the sheets if the hotel and the motel didn't change the sheets, and you go lie down there, you're going to catch the scabies from the sheets. And that is not uncommon to see. Or somebody has a scabies and they shake hands with you, and you can get scabies from them. So the treatment for that would be different. We definitely have creams that have to be applied a specific way, and then the clothing, the sheets, and etc. needs to be washed, and we instruct the patients how to do that. By the way, this one, scabies bite, tends to wake you up in the middle of the night, and people often feel something crawling under their skin. They're not crazy, there's something going on. These little buggers go right under the skin, and they can be very annoying and very itchy and very uncomfortable.
How big are they? Can you see them with your naked eye?
You cannot see by naked eye. No, you cannot. You cannot see the scabies mite. No, it's a microscopic thing.
Okay. Well, you mentioned about getting rid of the bed bugs with heat, and I've heard about the similar things of heating up the thing. So, do you think a good, really good, hot, good one, steam cleaner, like the way you clean a carpet, cleaning the mattress, cleaning everything in the house, which could possibly be steamed, would maybe do the trick? Because those things usually go above 120 degrees, no?
I'm not sure about it. I know for bed bugs, we used to recommend sometimes to get the clothing on, because it's that the heat would kill them. But I don't know. No, I can't say for sure if that's going to be helpful.
Right. What about the hydrating them? You broke up here a little bit.
I didn't hear you.
Yeah, you broke up a little bit. What about the hydrating bed bug? I have heard about that too. There are some powders which you put around wherever you possibly can, and apparently once they get it, it seems to be dehydrating them. Never heard of that.
I'm not familiar with that. No, I haven't heard about that.
So basically, what it means is getting rid of that source of bed bug is. You just got to work on it, and heating them up seems to be one of the ways to do it, except how to do that, not always an easy thing. So,
right.
So sometimes throwing out that mattress and doing still the heating, because they might be not just in the bed, right? They might be in the floor also, right? Especially if you have a carpet floor and stuff like that, right?
Well, they call bed bugs because they do tend to hide in the crevices on the beds, especially, and they tend to come out at night. So that's where they get the bed bugs.
Where do they come from? Where do they grow? I mean, like babies, we know where they come from. But where do they come from? Where do those bed bugs come from?
It's hard to tell where they originally came from. So it's hard to tell why syphilis or HIV, how they all started.
How do they travel around? How do they get from, is it that you slept in a hotel or anywhere else where there was one and then you brought it with, or what's the deal?
Yes, you could bring it in your luggage, yeah. You could bring it in your luggage. If they're in the clothing or sheets and stuff, and if you get into your luggage somehow, you can bring it in, and yeah, they come out of the luggage and they have a feast over there.
Okay. Well, all right. That's it about bed bugs, fleas, and all those beasties. Okay, it's not enough that we have those beasties in the computer. Now we have them in the bed also. Well, we had them in the bed before, so why wouldn't we have them in the computer, right? Bye bye.